Persons living with sickle cell anemia have been misdiagnosed time and again, especially during this coronavirus pandemic period, many ending up in isolation wards because they exhibit symptoms resembling those of a COVID-19 patient.
It will not matter where I'll be in this part of our lovely country. I'll be taken care of with any doctor, any clinician, any nurse, depending with which level of hospital I'll walk into, from level 1 to level 6. They'll manage my pain, because we all know sickle cell crisis, when a patient comes in, they come in severe pain. And the pain are caused stress first, and then you find out why is this patient having pain. We usually have pain because I might have infection, or I'm dehydrated, or my blood level is low, or I'm having another complication. And during this time of COVID, it has been very difficult for sickle cell warriors to just walk into any healthcare facility to be taken care of.
This comes despite the fact that over 6,000 people in Kenya have been diagnosed with sickle cell. Many others, especially children, hidden by their caregivers in the society that believe sickle cell is a curse.
Amongst us in our communities, we say the woman brought a curse to the home. People forget a child is a product of conception. And so as we speak today, these guidelines are going to foster greater understanding, not just for our villages like those in Busia, but also for those who meet sicklers in Nairobi, in Mombasa.
Before we find the cure, let's make sure they live more productive lives. Let's reduce that pain. Let's make sure that at least they can be in school.
These, among other major challenges, have led to the Ministry of Health, in partnership with other stakeholders, to come up with guidelines aimed at aiding patients get help in any healthcare facility.
The drugs should also be affordable. They should be available. We have issues of stockouts in this country. We run out of stocks of very essential medicines.
Due to the high cost of managing sickle cell, Dr. Frederick Okinyi, chairperson for Sickle Cell Federation, called on NHIF to consider medical covers for sickle cell therapies, which costs between 40,000 to 80,000 Kenya shillings, so as to cut costs for patients who need this and other forms of treatment and medication to manage the disease.
The NHIF package should be able to pay for red cell apheresis. It costs like 120 to take care of a patient with sickle cell. That is in a year. But if you do red cell apheresis, it costs between 40 to 80. So basically, you are cutting on costs.
To ensure continuity of services to sickle cell warriors and other persons living with non-communicable diseases, the Ministry of Health has also developed an interim guidance on provision of timely health services and prioritizing them for the second phase of COVID-19 vaccination. Robi Omondi, K24, Nairobi.